Do you think air conditioners in some of the newer cars and in the winter the heaters, that cause windows to be rolled up, are some of the major causes for motorists failing to notice ambulances and emergency vehicles?
Well, sometimes when you're driving down the highway behind a car and they don't pull over, you kind of wonder yourself just why. But of course, with the windows rolled up and these stereotape decks and different things going on in the cars, why it's hard to notice an ambulance. But I don't know what you can do about it other than that.
What safety precautions are taken to protect patients in vehicles or in the ambulance during a typical run?
Well, we try to use solar patients on the cots, on the auxiliary stretchers. We also, for our red lights and stop sign, we come to almost complete stop. This is the orders instruction our drivers all have. We just drive. We keep our control speed limits, which is just very little above the normal speed limit, if any. And we just shoot that way to keep them real. But we figure our patient care is our first interest on this, and try to get there as quick as we can and safe as we can.
What recommendations would you like to pass on to the public to aid emergency vehicles on a run?
I think a real important thing would be to look up in your rearview mirror every now and then and keep aware of what's behind you, and of course watch the sides and what's in front of you, just normal driving. But also, whenever you see an ambulance coming up behind you or any emergency vehicle, try to get over to the side of the road without involving yourself in an accident too. And if you're in a situation where you can't move out of the way, like you're at an intersection, just stay where you are, and the ambulance will generally try to pass on the left side, even if you're in the center. And if you can't get out of the way, just sit still and we'll get around you.